Hello and welcome. Today we have a special guest. I know I keep saying that every time we have a guest, but this one's really special, as you will see and hear. So Carol Petersen has a Bachelor's of Science from University of Wisconsin School of Pharmacy. For the past 25 years, she has been working with Women's International Pharmacy with compounding bioidentical hormones and therapies. Carol writes and edits a newsletter called Connections. With her work at Women's International Pharmacy, she attends around 20 medical conferences per year, so she's able to stay at the cutting edge. Carol co-hosts a radio program in the greater New York City area for the last 6 years called Take Charge of Your Health. She's also certified in nutrition from the Institute of Holistic Nutrition here in Toronto. Her Facebook page, Wellness with Carol, or at Wellness Carol. Carol, welcome.
Thank you, Alex. It's my pleasure to be here today.
And I want to share something because I think that I attend 3, 4, sometimes 5 conferences a year, and really is plenty for me, although I wish I had a chance to attend more because it's always fascinating to learn new things. But what I didn't realize is that you attend them continuously, basically. Everywhere I go, there you are. So.
Yes, I was reminded, I just had a visit in Oak Brook, Chicago area. Remember, Alex? Last year we were there.
Chicago. No. Chicago. Was it last year? I don't know.
Yes, it was last year. I had my arm in a cast.
Oh, yes.
So I was reminded of you.
Anyway, I wanted to talk to you specifically about certain things, such as hormones, women's hormones. I mean, the subject is obviously huge, and one interview is not going to do it, so we may have to do it again. But question number one, and I get asked that by many people that I see, what is the difference between synthetic and natural or bioidentical hormones?
Okay, that's quite easy. So when it's bioidentical, it's the same structure as your body makes, even though the process in making these is called semi-synthetic. There's a nucleus of 4 rings. If you look at the structure, you can look it up on Wikipedia, and you can just look up cholesterol. These are all made from the basic cholesterol form. So your body puts different additives, methyl groups, ethyl groups, ketones on that cholesterol molecule and gets different hormones. We can also do that in the laboratory, and that basic 4-ring structure has been extracted from plants to make the whole process easier. But the important thing is what's on that molecule. So this is the same basis for all the synthetic hormones. And by synthetic, I refer to those hormones that are not exactly the same as what we produce in our body. We can put different kinds of groups on that basic molecule, and we get new molecules that have never been seen in our body before. For example, for progesterone, they've created medroxyprogesterone. For testosterone, methyl testosterone. And our whole health system favors a drug company producing a foreign molecule. They're given a patent. They market, the hell out of it, and try to convince medical practitioners that somehow this alteration is an improvement on what you have already. And of course it isn't. It creates big problems, side effects, which I hate that term. They're effects. You put something in your body, it's going to do what it's going to do, no matter what. If it's not the main thing you want, we call it side effects, but it's still predictable and it's still going to have an issue. we are lucky enough to live in a time where we have access to hormones that are identical to ours. And this gives us a great benefit. So you use them, you don't stress the liver, you don't stress your body with fake molecules. And if you are into testing some laboratory, you can test before and you can test after. The after amount will be the total between your hormones that you made and the additional that you supplied. Mm-hmm. So this is probably more scientific than anything you could imagine out there. So it really makes me wonder how physicians can continue, when we have these tools already available, continue to treat their patients with phony molecules and expect a good result. It just does not happen.
Yeah, I've never understood the term side effect.
Yes.
No, it's effect. I don't know which side, whether it's the left side or the right side. But sometimes, they would even prescribe things like off-label, prescribing things based on side effects, which is total kind of mystery to me. Anyway, tell me something, because we had a conversation recently, and you said, I know the answer to a very important question. So here's the important question. A lot of women are taking progesterone cream, bioidentical progesterone cream. And what if that bioidentical progesterone cream doesn't work for whatever reason? Can you explain kind of the mechanics behind that?
Right. I can give you a lot of explanations. And I'm really astounded, because what prompted that conversation was I was just at a conference for people presenting, and it was question and answer period. They're asked that question. They've written a book. They're training all these practitioners, and not one of them had any answer. So I'm going to start with the easiest. People sometimes don't get enough progesterone. And this is a myth, I think, that's been promulgated. I'll blame John Lee. I'll give him credit for doing a lot for improving our knowledge of progesterone, but I'm going to use a strong word. I condemn him for telling women they don't need more than 20 or 30 milligrams of cream, of progesterone in a cream. And what happens when women do that, and they're already have a large amount of estrogen effects, they have headaches, anxiety, their breasts are swollen, their body's swollen, fluid retention, they can't sleep. And you give them a tiny amount of progesterone and bam, you make everything worse. And they can't possibly take it. And I agree with them. It's hell. What has happened is progesterone is the hormone that sensitizes estrogen for its receptor. Mm-hmm. The receptors are heightened, so all that extra estrogen you have on board suddenly balloons up. And then often when people are starting progesterone, I'll say people, men and women too, right. When they start progesterone, they may be low in adrenal hydrocortisone. Progesterone is an immediate precursor. So while you have this ballooning of the estrogen effect, you're losing the progesterone to make more hydrocortisone at the same time. And you're left with basically nothing to support that enhanced effect that you've gotten. When I first started working for Women's International Pharmacy, we worked with women who were severe sufferers of PMS. I'm talking about women who went into seizures, they were suicidal, they were off the wall crazy, they had huge amounts of pain, headaches, mm-hmm. and our starting dose was 100 milligrams of progesterone 4 times a day. And increase as needed. Some of those women went to 2,000, 2,400 milligrams of progesterone before they got relief. And they did. So I'm not afraid of progesterone. I think it needs to be used liberally. They also had breakthrough doses. So if they were doing okay and they started to have a little breast tenderness, their doctors would give them a sublingual, even rectal solutions. Get more progesterone in. Very, very important. And it worked. In retrospect, now we're 30 years later. In retrospect, we have a lot more tools to work with this excessive estrogen. We know how it's metabolized might be an issue. The liver could be an issue. The gut could be an issue. Xenoestrogens from the environment could all be issues.
Right.
We have learned how to deal with this huge amount of estrogen. So it's not so longer so necessary to go so high with progesterone to meet that huge estrogen. You can work at both sides of the equation. I'll give you a story. We had a young woman, who was bleeding excessively every month. During a menstrual period, she went in the hospital and had a blood transfusion. This is too much estrogen. This heavy bleeding, and it's a big problem perimenopausally for a lot of women. And if you use progesterone in the first part of the cycle, the follicular time to moderate that stimulant effect of estrogen, you're not going to build up such a huge layer that you have to have massive bleedings.
Right.
This young woman, after she had the blood transfusion, she was given birth control pills to take 2 or 3 at a time. Go, oh my gosh, it's nothing worse you could do. You set her up for the next bleed for the next month. It was really, really poor medicine. We got her stabilized on 1,600 milligrams of progesterone in lozenges, which she took every day. So no longer did she build up this huge layer that had to be sloughed. That was, just saving her organs. Alex, there's in the US, I'm not sure for Canada, 700,000 hysterectomies are performed per year. And a good deal of them are performed because women are having excessive bleeding, and it's so easy to fix, and nobody's doing it. So that's number one. Not enough progesterone.
Yeah, I've heard years ago it was 600,000, which it's a huge number, and I was hoping it would be going down, but apparently it's going up. So anyone's complaining about uterine fibroids, whoops, now you have to have a hysterectomy. But that's another subject. With, how do we know that the bioidentical hormones are safe? I think a lot of people, even if they understand that they may need to supplement or they need to kind of work on estrogen metabolism, there's some people that are still afraid or concerned that these hormones, as close as they are to your own, they're still obviously not your own. How do we know that supplementation is safe?
There's a nice article by Kent Holtorf. He put together a meta-analysis of a number of studies showing that the safety and efficacy of bioidentical hormones is there. We don't have huge amounts of studies. We don't have length of time, like how long are you going to use these hormones, and you can get different consequences using things a short time and a long time. However, I have to say that using bioidentical hormones has been embraced by medical organizations who are concerned with healthy, happy aging. Mm-hmm. Aging, the symptoms that we call aging are primarily hormone deficiency symptoms. And as I referred to before, we're lucky enough to have these as tools to top off. Now, having said that, let me go back to the situation where progesterone is too little and you exacerbate the estrogen effects. Here is where I think there is a danger. I've asked several physicians and they don't agree with me, but I'm going to propose that if you keep a woman suffering with little or no progesterone added to an excess estrogen state, you are headed for trouble. And been monitoring some Facebook pages. It's incredible to me how doctors, even using bioidentical hormones, are ignoring this when their patient is not comfortable. So you're in a high estrogen state, made worse by progesterone. That's going to be a problem. The hormones have to be used so that you don't have symptoms of imbalance or excess of one, excess of another. I'm also monitoring women and men using testosterone and using pellets, which seems to be very, very high doses and out of balance. Their doctors are not paying attention to the other hormones. It's like testosterone's a panacea and it's going to fix everything. Yet women's voices are changing, their hair is falling out, and they're getting acne and they're gaining weight and they're not happy. Well, it doesn't, don't blame the testosterone because women need it badly and so do men. It's how it is being dosed in excessive doses, but not in balance with the other hormones. So I have to concede it could be done improperly and we have a problem. But I think under the right conditions, doing it in balance with each other, the hormones that we do know, you're going to have a much happier life and a healthier life. And that's already bearing out. We're seeing, just anecdotally, practitioners are saying they're seeing less breast cancer in their practice when they're using bioidentical hormones. I think that would be of interest to you and the thermography work. Progesterone is very protective for breast cancer. If you have breast cancer and you have are positive for progesterone receptors, that's a plus. Your conventional doctor will say, oh no, don't use progesterone. But the real effect is progesterone activates the P17 gene, which takes care of cancer cells and increases the breakdown of the cancer cells. So those doctors are denying those patients a very, very powerful tool. And that's bad. Testosterone actually is protective for breast cancer and for men for prostate cancer. And again, no reason that this should be totally denied. And vitamin D, totally protective for prostate and breast cancer, should be employed by everybody.
I totally agree with you. First of all, it all depends on the dose. Not just the dose, it all depends on who you are working with in terms of who is prescribing this. There are a lot of people who have experience. There are a lot of people that are just kind of getting into this field. And I'm talking exclusively about bioidentical hormones, not synthetic. And maybe by trial and error, but maybe they can try this on animals first before they start it on people. Not that I support animal testing, but
I'm in favor of that, by the way. You know how many animals we neuter and spay?
I don't want to hear this.
They need hormones.
Don't use not with me. It's painful just to hear about this, but
it is.
I want to ask you about the estrogens, okay, and specifically the estriol as a therapeutic kind of agent, because estriol, as we all know, is also a very protective estrogen. Tell me a little bit more about this.
Okay, we actually have discovered in the interim of my 25 years that there were two types of receptors for estrogen, alpha and beta.
Right.
And the beta receptors pick up more of the estriol, higher affinity than estradiol, which is the ovarian main hormone. So, and vice versa, estradiol stimulates the alpha receptors mainly, but there's crossover. And we still have a lot to learn about that, I think. So estriol has been thought to be very protective for breast cancer or uterine cancer, ovarian cancer, any kind of estrogen-related cancer. It's even been used in Europe for, it's actually a FDA approved, or I forget what their legal status is, estriol in some huge doses, 20, 30 milligrams at a time. And that has been used to treat cancers and in some instances. I can't tell you the total success or not success, but if you are in an imbalanced situation and you do have excessive estrogen stimulation, having some estriol around would moderate that, as would progesterone and testosterone too. We shouldn't forget about those.
Right.
I've switched my thinking on this. I know Biest, a combination of estradiol, estriol is very, very popular. But now that I've gotten to be older, I really want estradiol. And I'll tell you why. Estradiol, but not estriol, is more neuroactive. It's the estrogen that's really going to help your brain. And I feel that's a pillar of successful aging. If you don't have your brain, you don't have anything. Right. So I have switched. And I think for a lot of women, if you use estradiol, estriol is one of the metabolites, and you can still check for it. You may be metabolizing just fine, but another approach would be to use estradiol, make sure that everything's going okay with estrogen metabolism. We have a lot of tools for that now, rather than depend on added estriol. So that's my position right now. And I have to say I changed from my younger years. My brain has become more and more important to me.
So, and let's not forget that it's also used estriol, also used for vaginal dryness, which
now
going through menopausal or postmenopausal years seem to kind of need that support as well.
Yes, estriol is 800 times stronger than estradiol in the vaginal area and in the urinary tract and the bladder. Estriol is hands down more effective. So there are some commercial estradiol products for vaginal, but it's not going to touch estriol. And I'll tell you from years of compounding this, 1997, there was a New England Journal of Medicine article, and it was older women with recurrent urinary tract infections, and they used estriol vaginally. The dose, I believe, was 0.6 milligrams per gram. So everything healed and no more urinary tract infections. And so that's pretty obvious. So nothing works like estriol in my experience if someone is dry and irritated and urinary tract problems. You can get relief in a couple of weeks. Estradiol can't touch that. Often it's prescribed to use it until everything's cleared up and then use a maintenance dose. Estriol, hands down, the winner.
Right. And let's not forget, it's also the hormone of pregnancy, which really makes it, I think it makes it safe. And I think that women are at their healthiest when they're carrying a child.
Yes, but that woman who is experiencing nausea during pregnancy could get some relief. They're needing more progesterone at that point. As even estriol can be causing some symptoms when there's some disbalance.
That's interesting. I haven't thought about it this way.
Yeah.
It is a fascinating subject of hormones. Now, it's not just, since you touched on testosterone, I guess testosterone as well as progesterone could also metabolize into kind of lower estrogens.
Yes.
Estrone, estradiol. How do you prevent that conversion of testosterone or progesterone conversion to estrogens?
Okay, progesterone is most likely going to go to the hydrocortisone. So testosterone is immediate precursor of estradiol and metabolites estrone. So that can and does happen. Now the question is this something you need to suppress? And this is debated a lot by men using testosterone. And if you suppress estrogen too low in men, they won't have any libido. They won't be fertile. This is a big problem. So they're often prescribed aromatase is the enzyme that converts. They're prescribed things to inhibit making estradiol. So there's a big discussion. Some doctors say, leave it alone. Other doctors say, oh, no, you can't have too much estrogen. Now, I'm in the camp with, I would sort of leave it alone, but I would bring up that progesterone's a natural aromatase inhibitor. And I would submit to you that if men in this situation, if they are getting excessive estrogen, I would go for progesterone to help that. And it has been used for insulin resistance, prostate hypertrophy in men, because it does work. It is the hormone in your body that should be doing that, rather than, again, like you're using a bioidentical hormone and then you use a drug to try to manipulate what it does. That's a philosophy I don't like.
Right. It's a fascinating subject. So since, we will also want to touch on breast health. What advice would you give to women when it comes to bioidentical hormones and breast health?
Okay, this is a real good one, and I'll tell you from my own personal experience. I suffered from fibrocystic breast disease for years, and anybody who has it knows how painful it is prior to your period. And people were saying stuff like, don't use caffeine, you can use vitamin E. But when I started working at Women's International Pharmacy, I started using some progesterone I was putting it around my eyes for wrinkles. It's good for your collagen. And lo and behold, just on a relatively small dose, but I was younger then, all these cysts started to disappear. And I remember speaking to Dr. Eugene Shippen on the telephone, and he said, we get rid of cauliflower breasts all the time, he said, with progesterone and iodine. So I had the largest cyst remaining at that time. I added the iodine, gone. Never had another problem. If I feel like there's some soreness, I put progesterone cream right on my breast, gone. Now, I'll say one addition. One of my coworkers, same problem. And she didn't get relief till she actually added DIM, progesterone, iodine, and DIM, diindyl methane, which helps you metabolize estrogens. So that was a success. So start right there. Don't wait till you have bigger problems. It's like a red flag. There's an imbalance here, and it could be mitigated. Your breast tissue needs huge amounts of iodine. We always think about iodine and thyroid, but your breasts need it too. And there was a doctor in British Columbia, David Derry. Do you know him, Alex?
No.
Oh, he wrote a great book called Iodine and Breast Cancer. He actually was having very good success treating women with breast cancer with iodine, and then thyroid too, whole thyroid. So that's something that needs to be very much looked at. And I want to do a little bit cautionary thing here too, because I was quite shocked to read an article about women using natural whole thyroid were developing breast cancer more than those that were not. And I go, how can this possibly be? Thyroid's so good for your breasts as well. But I think the answer is iodine. A low thyroid person, recognized by their doctor to be low thyroid, is given thyroid. However, why was she low thyroid? There's probably an iodine deficiency going on in the first place. So that iodine deficiency was crucial to the development of breast cancer, but not recognized as even more fundamental than using whole thyroid as a supplement. So it's very, very important. It's also involved, iodine, I believe, is involved in conversion to estriol.
Right.
Back to our original thing. If your body doesn't have enough iodine for that conversion, you are left with the more stimulant estrogens in play rather than the weaker estriol.
Right. Everything's connected to everything else. And I just want to make sure that, people don't run out and start buying iodine and drinking it straight out of the bottle. That's not the way it works. Please find find a professional of your choice and work with them. There's no kind of negative to getting educated and kind of getting your way around, and that's why we're having these interviews for educational purpose. But since you mentioned something about DIM, I know DIM. There is a little bit of a controversy, and I wanted to ask you for your personal opinion, the difference between DIM and indole 3-carbinol. Some people like 3C, some people like DIM. What's, in your opinion, is it kind of individual where you have to try one and see what works for you? Anyway, just wanted to ask you your opinion.
Yeah, both have potential for working, and I really am not clinically involved that I could give you a definite yes or no. The preponderance of what people are saying out there is that DIM is the better choice, but I think either probably does work. DIM gets metabolized from indole 3-carbinol, so away you go. So I can't say.
And just for the benefit of those who are not familiar with DIM or indole 3-carbinol, it's made from cruciferous vegetables. It helps with estrogen metabolism. Helps with conversion or blocks the conversion from good to bad estrogen. And, we all heard that cruciferous vegetables are good for you. Not too many people are going to be eating 16 heads of cabbage a day. And if you do, by all means, I personally like cabbage, but not in those quantities. But so someone actually isolated the active compound and they made that into indole 3-carbinol or DIM. So, try it for those that have estrogen-related issues. I think it works. Over the years that I've spoken to many women, I think in many, many cases, it really works very well. Also, to add to that is carbon D-glucarate, right? Which
that was calcium D-glucarate.
So sorry, calcium.
Yeah. And that works in the gut. When you have abnormal gut flora in your microbiome, there's an enzyme, beta-glucuronidase, being formed. And what it does is unhinges the conjugated estrogen that's in your gut, ready to be excreted, takes the conjugate off, puts the estrogen back into your body. It's called enterohepatic recirculation of estrogen. So you can actually become hyperestrogen just with your own hormones. And when that gut flora, the calcium D-glucarate can be used, and then the beta-glucuronidase latches onto that instead of unhinging the estrogen conjugates, and that's how that works. So that's one of the, as I mentioned, there were techniques for dealing with excess estrogen. This is one of the places where there is excess estrogen, and this is how you would cope with that problem, along with improving your gut flora.
and just to make sure that we're not talking about calcium supplementation, it's just called calcium D-glucarate. It's not. We're not advising people to take calcium, which is in many cases contraindicated with someone who is at high risk for breast cancer or has breast cancer to begin with. So maybe not the last question, because I know we have a lot of questions and possibly we can have another segment on this. Tell me, when it comes to delivery, because that's also important. My understanding is that creams are the best, going through your skin, bypassing the hepatic or liver pathway. What do you think? What's the best way of delivering kind of bioidentical hormones therapeutically?
Okay, so this is one of my bugaboos. So you hit a hot button. I'm going to unleash on you.
Okay.
Okay, what's the first pass liver effect? Theoretically, what you put in your mouth is absorbed and goes into liver circulation first. If you put it on your skin, if you do it rectally, vaginally, sublingually, it doesn't go to your liver first. However, it doesn't mean it doesn't go to the liver. Within 2 to 3 minutes, it's at the liver. The first pass effect was developed to increase the amount of any substance in the bloodstream until it gets to the liver in that precious couple minutes. So what's protected for the liver is the nature of the hormone, not that you didn't deliver it to the liver first. Having said that, there's different ways the liver will handle it when it does get there, depending on how you use it. Another thing that's always assumed with not good evidence is that your hormones do go right to the liver when you take it orally. And actually, it's absorbed like a fat. And fats are absorbed by chylomicrons. Attaches to fats, takes it into your lymphatic system first. So all steroids are absorbed like that. And people tend to ignore it, though they think it's just like a protein or carbohydrate in your gut. Fats are always universally done differently by your body. And consequently, if you're using a hormone orally, you should have it with a fatty meal or fats, and you'll get better absorption that way. So I'm often asked, like, okay, there's another bugaboo here with the creams. And this makes me a little crazy. There were numerous studies produced, and they used oral estrogen, but they like to mess up the situation. The oral estrogen is almost 100% conjugated estrogens that come from horses that are not compatible with human biology. So they use that estrogen, and then they'll use estradiol, the wonderful bioidentical hormone that your body makes, and they'll use that on the skin in a cream, gel, or patch. There's various ways you can do that. So lo and behold, the oral estrogen, but not the topical, on your skin estrogen, produces higher fibrinogen, so you worry about clotting, C-reactive protein, you worry about inflammation, higher sex hormone binding globulin, which is a protein carrier for hormones. And if there's too much, you have too much binding of the hormone, so you don't get good effect. So everybody's saying, oh, don't use oral estrogens, don't use oral estrogens. However, this has not been really studied, estradiol, oral to estradiol on the skin. And I just did another review searching for this kind of information, and it isn't there, or what is there is equivocal. Oral estradiol may not be the villain, Premarin is. Mm-hmm. But we get, so this thing like, oh, only use estrogen on your skin. I say, only use bioidentical estrogen on your skin. And then if you do want to take something orally, it should be estradiol. It should not be conjugated estrogens. It's a travesty from the horses.
Right. So postmenopausally, the sex hormones are no longer produced by ovaries, and adrenals will take over.
Right, right.
Just like at puberty. Now, adrenals, that's another huge subject with adrenals, because as we're all under stress and as we're all kind of 7/24 with our cell phones and so many things that are disturbing us on daily and nightly basis, our adrenals are starting to basically hypofunction. There is a thing called DHEA, which is kind of used for adrenal support. Tell us a little bit about that, and because adrenals are also connected to obviously to thyroid, but the whole endocrine system.
Right, and it's one of the most important parts. If you didn't have your adrenal glands, you'd be dead. As opposed to maybe cutting out the testes or cutting out the ovaries.
There you go again. Please.
Just a little graphic here. So But that's done. It's done all the time, right? So the adrenal glands, major hormone is DHEA, and it's a precursor both to testosterone and to the estrogens. So it could theoretically give you that type of activity. And in fact, it does. Your body does metabolize it. Until some research was done, I would say maybe 20 years ago, DHEA, although it's the most abundant steroidal hormone in your body, was only thought to be important because of its precursor to the other hormones, such as cholesterol is. However, we now know that it has many direct effects, and it has a really important roles to be formed in bone formation, your muscle and body integrity. It's a hormone that builds up like testosterone does. Correspondingly, cortisol, actually another major adrenal hormone, has to be used in the appropriate amounts to be safe. Excessive cortisol, whether you take it, or if you are producing excessive cortisol with your adrenals, that actually can be a breakdown hormone if you don't have enough DHEA to balance. So when we talk about menopause and andropause, I think you bring up a very good point. I think the whole thing is really adrenal pause, because in the natural course of events, the reproductive organs will be winding down as you age, and it's left for the adrenal glands, which have been helping all along, but now they are it. And I don't know what it is for men, but something like 80% of women have menopausal symptoms. That's a huge amount. So it tells me 100% that they don't have the adrenal resilience that they should be having. It means that we live in a very stressful environment, and we're suffering as a consequence.
So let's leave on a positive note.
No more cutting up stuff.
Let's not do any testing on animals. Let's leave all our parts, where it should be. Let's actually support that they work a little better and function kind of the way they should be. What would you say, what would be your advice to women who, number one, suffer from either menopausal or even perimenopausal issues when it comes to breast sensitivity, when it comes to kind of many other symptoms like lack of sleep, maybe being irritable, and so on and so forth that comes with that?
Okay, I love what you're saying, because those are hallmarks of not enough progesterone. And because of all the stresses in our society, progesterone's apt to be diverted to help the adrenals out, and is an adrenal hormone on its own accord. When progesterone is not enough, those are the type of symptoms you get. So start with progesterone, first hormone that should be used. And all those symptoms, the sleep, the breast tenderness, the anxiety, irritability, take enough progesterone so they are hot flashes too. Progesterone's more important for hot flashes than estradiol is. Take enough progesterone so you have zero. Then, as you're going along, you might need some estrogen too, but you bought some time because progesterone actually helped with whatever estrogen you had on board work better. The symptom I think is easiest to monitor for women for low estrogen is what's the state of their vaginal tissue? Are they juicy? I'm asking them if they're juicy and feel healthy down there. Women are really suffering from dry vaginal tissue. And think of the consequences of what happens to a relationship and how you feel about yourself as a woman and in relationship with men, how devastating that could be to a good life together. And it does not have to be. It's easy to fix. So quickly after estrogen, I'd add testosterone. And testosterone is the hormone directive of all protein synthesis in your body, which means if you want to maintain a good, healthy body, as opposed to sarcopenia, you see little old men, little old ladies wasting away. that is screaming. Not enough testosterone. You cannot keep your body rebuilt. You're in a constant process of breakdown and rebuilding. Testosterone is the main deal to keep that rebuilding happening. So that would be next. And I throw in DHEA right about the same time. If you start with progesterone, you don't run into this problem with, you have so much estrogen that immediately gets overactivated, and then you feel like you can't take progesterone. You get rid of that problem entirely. You add the estrogen to the progesterone.
Great. I love your advice. I need to ask you to come back, because this is just we're really kind of touching the surface. We're not even getting deep enough into this, and the subject is very important. I don't think that it's covered in the media appropriately, or given even enough kind of time for this discussion. But talking to thousands and thousands of women, I realize how important it is. And there's so much information and so much disinformation. They really don't know what to take in, because there's so much of contradictory opinion and all that. So I would love to have another interview with you at some point. Please come back.
My pleasure. Okay.
And I want to thank you. This has been illuminating. I've learned a lot, just by talking for the last half hour or so.
Uh-huh.
And anyway, I bid you all the best. See you at the next conference.
Okay. Okay.
Now I know where to get all this information. It's really exciting. It's exciting for both of us.
Yes,
Take care. Be well.
Okay, bye-bye.
Bye.